I'm Troy Bowden. I'm here at St. Mary of Victory's Church in downtown St. Louis. This church was the first true home of our founding sisters, but their first true hospital was St. Mary's Infirmary. The infirmary doesn't look like much now. Time and fire have taken their toll. Still, in its prime, this large and stately hospital played a significant role not only in the sisters' ministry, but also in the history of St. Louis. After caring for the sick in their homes for a few years, the sisters realized they needed a more dignified, cleaner place to treat people than in the city's crowded and unsanitary tenements. Eventually, they would make a down payment on a large house away from the industrial soup of the riverfront. They remodeled the house into a hospital, and in 1877, St. Mary's Infirmary admitted its first patients. That first year, 82 patients were admitted. 15 of those cases were listed as charity. Later in the infirmary's patient registry, the sisters took to writing ODL for charity. ODL stood for Our Dear Lords, which indicated these patients could not afford to pay. A little over a decade later, to provide better care and accommodate more patients, the sisters opened a new modern St. Mary's Infirmary on Papin Street. Over time, additions were made to the infirmary because the need was so great. During the Great Depression, for instance, the sisters served more than 163,000 meals to the poor in 1 year. The infirmary became significant in the sisters' ministry for another reason. In 1933, at a time when segregation was commonplace in society, the sisters made the courageous decision to operate the infirmary as a hospital for African Americans. St. Mary's would be the first Catholic hospital for African Americans in the nation. St. Mary's Infirmary would also become a place where African Americans trained to be physicians, nurses, and allied health professionals. The infirmary remained open until the 1960s. When the civil rights movement changed America, there was no longer a need for a hospital for African Americans. The hospital eventually closed and was sold, but St. Mary's Infirmary is not forgotten. To this day, many people in St. Louis still remember the infirmary and how the sisters cared for the poor and the African Americans in the city.